Hello, viewers. Welcome to my channel on sharing medical knowledge to save lives. Today, the topic is cardiac arrest, which is a medical emergency and can happen to anyone. In this video, I want to talk to you about the knowledge that you need to have to save someone who is suffering from cardiac arrest, even though you don't have a medical background. I am Dr. Shekhar, and I'm an internal medicine trained physician in the United States and have been practicing in the United States for the last 12 years, treating critically ill patients and hospitalized patients. First and foremost, why is it very important to know what you should do when someone is suffering from cardiac arrest? Well, this is a medical emergency, this is a very serious condition, and you could be the difference to save the life of the person that is suffering from cardiac arrest. Why is it important that you should act fast? Well, when the heart stops, within 6 seconds, people lose consciousness. And within 3 minutes, the brain will start to die. And within 10 minutes, the person who suffered from cardiac arrest might not come back. So you need to act fast, you need to act right away. Let's talk about what is cardiac arrest. It's nothing but when the heart stops beating and it doesn't pump blood. When it stops pumping blood, what happens is the person loses consciousness, they stop breathing, and they don't have pulse and they collapse. Do you think someone might know if they're going into cardiac arrest? Yes, sometimes some people might experience chest pain, some people might be having difficulty breathing, some people might be noticing some palpitations. At that time, it is very important to take the help of emergency medical services. Why does the heart stop? Well, we have an electrical system in our heart which allows the heart to pump blood and go in a smooth fashion. Sometimes what happens is the electrical system might malfunction and can lead to the heart stopping suddenly. What causes this electrical malfunction? Well, it could be a variety of things. A heart attack can cause this problem. Sometimes, if the heart muscle is too thick or too thin, sometimes the valves are too leaky, or sometimes they're too narrow to pump blood. Sometimes it could be a simple genetic conditions that you might be born with. What can you do as a general public without medical education or medical knowledge? Well, there is a lot of things that you can do. First and foremost, what you have to do is call for emergency medical services right away. So if you witness someone is going through cardiac arrest, call 911 as soon as possible. In some other countries, it might be a different emergency services, but call them right away. The next thing that you need to do, this is very time critical, is to start doing CPR. Well, what is CPR? CPR is nothing but cardiopulmonary resuscitation, where you're trying to simulate the heart pump. You're compressing the chest of the person who suffered cardiac arrest at least 100 to 120 times per minute until the medical emergency services arrive or the person gains consciousness or the pulse is back. What are the things that you can do? Sometimes, in order for the person to come back or the heart to restart, the heart needs electrical shock. In most of the places, public places in the United States and in some corporate places, they carry a device called automatic electronic defibrillator. This is a device that delivers shock to the heart. So it's an automatic device. You have to follow the voice prompts and do what the device says. And sometimes the heart needs a shock that can bring the heart back, and you could save the person's life. Where can you learn to do these things? Well, there are many resources. There are a lot of educational videos out there on the YouTube. But as a medical professionals, we learn these techniques from American Heart Association Basic Life Support. And if you are really interested, you can do an advanced life support as well. It's called BLS and ACL. And learning this is very critical because you could be saving your family member the next time, or you could be flying in an airplane and you could be saving someone who needs help. You don't need to be a doctor to save someone. Who are more prone to develop cardiac arrest? Cardiac arrest can happen in anyone, but if you have some of the risk factors, like if you smoke cigarette, if you have uncontrolled high blood pressure or uncontrolled sugar, or your cholesterol is too abnormal, you know, or you're leading a very sedentary lifestyle, you're overweight, not exercising regularly, you know, or if you're using illegal drugs. Sometimes, if your body electrolytes without your knowledge are abnormal, all these things will put you at a higher risk for cardiac arrest. And what can you do to save yourself? The most important thing would be, if you're having any of these lifestyle diseases, trying to control them is the most important thing. If you have high blood pressure, high blood sugar, or high cholesterol, try to take the help of the medical professionals to control them or try to treat them. If you're using illegal drugs, try to stop them. And if you take alcohol, try to be in moderation, not to excess or not to drink excessively or binge drinking. If you're overweight, try to lose weight. And if you're and try to incorporate exercise into your day-to-day life. Try to manage stress in your life. Try to maintain healthy lifestyle. Try to exercise. Lately, there has been some concern about exercise and cardiac arrest. There have been few studies that have been done, which did not really say that exercise can lead to cardiac arrest. Well, I mean, like if you are sedentary and all of a sudden you come out and do a 3 hour triathlon, you're prone for cardiac arrest. But if you're slowly increasing your exercise capacity and doing exercise on a regular basis, that decreases your risk of cardiac arrest. Bottom line is, even without the medical knowledge or even without the medical background, you can help someone suffering from cardiac arrest. The first and foremost, if you're in such a situation, try to call emergency services for help and start doing CPR right away. This is very time critical. And also be aware of what is AED, or automatic electronic defibrillator, and try to learn about it, man, which is a useful tool. And always keep in the back of your mind that AEDs are available in most of the public places in United States. And know what are the risks. I mean, like, who is at risk for developing cardiac arrest? It could be your parents, it could be your mom, dad, you know and encourage them to do the lifestyle changes in yourself or in your family members, so that we could prevent cardiac arrest. I hope you guys like this video, and we're going to make more such videos about various other medical topics. Please do like, subscribe, and share. Thank you.